All right, cool. Hey, welcome to today's episode. That's so funny. My guest today is a doctor. His name's Steve. Hey, it's Doctor Steve. How you doing, Doctor
Hey man,
Steve?
how are you? Good to finally meet you in person.
Yeah, no, I've seen you a bit. It's same here.
Yeah,
Great to
likewise.
no, great to see you. Uh, no, yeah. Sorry for felt so tired. I was up making like bets online. I don't know if you do online betting.
I got banned from one of the sites just recently, and it was because I was using a VPN. So if you're ever going to
Oh,
be on one of those sites, don't use a VPN because apparently I was logging in from a state that it's not legal in, and so I
mm.
got this. So I had to send them a bunch of stuff, and I'm just you know, but tip to the wise: don't use a VPN when you're on a gambling site.
Oh no, I mean, they just don't want your money at that point. That's baloney. I
Well, they
think
don't
it's
want to give you your money, is what some of it
mm,
is.
mm.
There is a benefit on their side if they can say, "Oh, you shouldn't be on here," that and we can't give you, your winnings. So,
No, that's
and and Amazon did that to me.
really.
Yes, we had a really good month with the Amazon affiliate program, and they just decided, hey, we're canceling your account and we're not giving you your money. And there was really no reason for it. Nothing had changed. We've been doing it for 15 years. We just had an amazing month, and they just didn't want to give us the money.
Those corporations, I swear.
Well, it's hard to live without them, but they have their downside, and that was one
Yeah,
of them. So yeah, now our affiliate agreement is with Walmart, but what are you gonna do?
yeah. No, and I was gonna ask real quick. I know you're a doctor. Is gambling really an addiction, or is it? Because
Yeah,
is there a way to help that?
yes, there is. Do you think you have a gambling problem?
I don't think so, because
Okay.
it's more like I just have, when I have an extra $5, I'll bet it here and
Okay.
there.
Well,
I'm not,
yeah.
yeah.
If it's money that what I tell people, listen, I used to teach a course in casino gambling, and I would always tell people, and this is obvious and it's new information, but don't ever bet anything that you can't afford to lose.
Mm,
And that you have to develop sort of a disdain for that money, because then you go to win, not to not lose. And I used to have a poker class, and there were a lot of people there that wouldn't play to win. They were afraid that they would lose, and then of course, that became a self-fulfilling prophecy. But um, if you find that you're betting uh, your mortgage money and losing it and ending up in trouble, you may have a problem. And if you get behind trying to get it all back again by making crazy, tilt, going on tilt and making doubling up bets and all that kind of stuff is really dangerous. So I reckon it does appear to fulfill the criteria for an addiction. It's certainly a habituation. You get that dopamine rush in the brain when you're winning.
oh
And
yeah,
just watch Boss Man Jack. You ever watched him?
yeah. I think I've been recently getting into that and the
It's it's
tragedy.
it is tragic, and he's happy when he wins. And I've watched him win 100, turn 10 grand into 180 grand. He's good at it, but then he can't stop. And I made my kids watch it. I didn't make them. I mean, I turned it on, and then
Yeah.
they couldn't stop watching it. But even my kids are screaming at the YouTube, on the TV, going, "Stop! Just stop!" And you could just watch this inevitable decline as he loses it all. And the rationalization is classic sort of addict speak. Well, I had 180, I still have 150. Oh, f you guys, and then I still have 120, and I still have 80, and then all of a sudden, oh, I lost it all. I'm an idiot. What am I doing? I gotta stop, and then the cycle begins again. So
Yeah, and that drives me nuts, and I'm sure it drives y'all nuts too. That you wouldn't learn at least the second time or the third time.
Right.
You keep the
That's when you know
cycle
you have a
repeating.
problem. That's right.
Yeah, yeah. No, that's insane.
I have
That's
a friend that
especially.
got really behind in his gambling, and just stopped. He said, I just have to stop and not do this anymore." And so that was a functional response. He got a little behind and then got more and more behind as he tried to get ahead again. But he just stopped. Now, Boss Man Jack, you're like you said, it's just the second time, the third time, the 10th time, the 100th
Mhm.
time. And you look at his room and he's punched the walls and he's torn the door off the frame. And, he needs to go to a meeting. He really does. And if you have a problem like that, if whatever it is, if it is interfering with your lifestyle or it's making you miserable, then, starting with a meeting is a good place to go. There's some meetings for everything. Sex addicts, gambling addicts, narcotics, alcohol, all those things. They all have meetings. And if you live with someone that has, say, an alcohol problem, there's a meeting for you too called Al-Anon, and to help you just learn to cope with that, because these problems don't just extend to the person themselves, right? They're not isolated. They don't live in a vacuum. These problems spread out to the rest of the people that come in contact with them. So.
No, yeah, you're absolutely right. I didn't think of it that way because I see the gambling problem. Call this 1-800 number, and I'm like, well, what are they going to tell me? Just to stop gambling? Like, I don't understand how they would
Yeah,
help with
stop.
that.
Just stop.
Yeah.
No, they'll hook you up with meetings. They'll give you coping mechanisms. They do all kinds of stuff. Sometimes it's just good to talk to somebody to realize that there is a way out. Some people just feel, there's no way out of this. I'm so far behind. I'm never going to get out of this. And yeah, it's going to be uncomfortable for a while, but there is a pathway out of that. It's like cigarettes. I don't know if you smoke, but I used to
No.
smoke 3 packs a day, and, the thought of quitting terrified me, and then I realized, well, first off, for the people who are listening, if males in their 40s who are still smoking, it's the number one cause of reversible erectile dysfunction. So if you
Mm.
are starting to have a problem, you quit smoking, you most likely will gain, some of that function back, if not all of it. But that's the thing that made me quit. It wasn't cancer or heart disease. I dissected aortas that had, calcium deposits in them and they had ruptured and all this. That none of that scared me. But when I found out that it increased my risk of erectile dysfunction by, whatever, 400%, then was like, oh shit, I need to quit. So, but the thing about tobacco is people quit and they quit and they quit. The more times you try, the more likely it is that you will succeed. So if you've tried to quit multiple times in the past and have not succeeded, try again. One of these times it'll click. And that was true for me. I quit dozens of times until it finally just stuck. And the worst thing that's going to happen, if you think about it, you're just going to be uncomfortable. It's not like alcohol withdrawal where you can have DTs that can be fatal, or benzodiazepine, Valium and that kind of stuff withdrawal that can be fatal, or opioid addiction where the cold turkey is you're miserable, puking, with sweating and goose flesh and all this stuff for 2 to 3 weeks. And then you have this acute post withdrawal syndrome and malaise and depression and muscle aches and pains for up to 2 years afterward. Tobacco addiction, you're uncomfortable when you quit. So who gives a shit? You know, um, when you get to 6 weeks, you're vulnerable because you think you have it beat, and that was always mine. It was 6 weeks and 6 months for me. So if I got to 6 weeks and my wife at the time pissed me off, I would go, "Well, by God, I'm gonna show her I'm gonna smoke," and I'd go smoke. And I wasn't showing her anything. That was the lizard part of my brain going, "Yeah, yeah, yeah, you need to have a cigarette." And then at 6 months, you figure you got it beat. I could just have one. And I got that got me once. I was up in, Vermont, and, I had been quit for 6 months, And I saw a friend of mine smoking. I said, give me one. He's like, are you sure? And I'm like, yeah. I think I'm okay. I've been quit for 6 months. I'll be all right. I could just have one. The next day I bought a pack and I was back up to 2 packs a day within a month. So, once you quit, you can't go back. Anyway.
Man,
Yeah.
no,
Sorry to monologue. It just
no,
you hit on something that is, personally affected me. So of course it's all about me.
no. I I've never had I've always been a secondhand smoke person with my
Yeah.
mom.
Yes.
Love
Oh,
secondhand smoke.
is that right? Yeah. Secondhand smoke's an issue too. It does increase your risk of complications. No question about that.
Yeah, but it was nice and comfortable from afar. Especially with those
Yeah.
menthol cigarettes. Those are always nice.
Yeah. Yeah. I did those for a while. I couldn't. I never understood the allure. I tried it. I tried everything. I smoked Pall Mall, smoked Camels, and then Marlboro, and I ended up on Marlboro Lights, I think, or
Ooh,
Merritts. Some people
ooh.
out there remember Merritts. There used to be a cigarette called Carlton's, and what they had, and it was supposed to be less tar, less nicotine, right? But what it had was a bunch of holes in the filter, so that when you sucked on these things, all you got was air. And so what I would do with those to defeat that sort of fail-safe thing was I just ripped the filter off and smoke it that way, and made it 1,000 times worse. So anyway, it's stupid. One thing I tell people is if you want to quit smoking, just think every single time that you buy a pack of cigarettes, there's some corporate guy at RJ Reynolds going, oh boy, we got him to buy another pack, and you're just lining their pockets. And for some people, rebelling against that is a good impetus for quitting smoking too. So
Well, now they got the dirty lungs pictures and stuff straight on the packs and all that, and it's like that's
right.
still not stopping people from
No,
buying
that
them.
did nothing for me when they instituted all that stuff back in the day. It causes, the warning, the Surgeon General. It's like, who's the Surgeon General? Can you name the Surgeon General?
I
I don't
couldn't
know who
know.
it is right now. I have no idea. So it doesn't mean anything to me. It's impotence. Just quit so that you don't become impotent. Men out there and women out there, you're at risk for, lung cancer and stuff like that. You need to quit too. But that's for if I have a guy in there, I can almost always get him to at least try quitting because of that.
No,
And
that's a good.
if you lose all your money, you're not going to be having intercourse either. So that's another reason to quit gambling if you have a problem.
There's a few motivations there for sure.
Yeah, yeah, yeah.
I was gonna ask, so where did the whole doctor thing? I'm sure that came about. It took a lot of effort, to become a doctor. Where did it come from? Like as
Yeah. Well, I always
a
wanted to
young
do
man.
it, but
Hmm.
I've in my family I was stupid Steve, and what it really was I had ADHD, and in the 50s, they didn't know what the hell that was. So
Oh,
I was just labeled as an underachiever. I would get 99th percentile on the standardized tests and then get C's and D's in school. And I was bored to tears. I was just fucking around all the time and constantly in trouble. And yeah, I was just, yeah, I was an underachiever. So somehow I had to defeat that on my own. And my brother was a doctor. He was the golden boy in our family, and he's
mm,
14 years older than me. And he was a good role model, though. I really kind of wanted to be like him. I saw how people regarded him, and I saw all the knowledge that he had that he helped people with. But I felt I was too stupid to do it, so I got a degree in radio, television, and motion pictures. And so I have a degree in television directing, and I did that for a while. I worked for a large TV station in Raleigh, North Carolina called WRAL, and they had Mid Atlantic Championship Wrestling. And so I was cameraman and
yeah.
audio engineer for Mid Atlantic Championship Wrestling. I worked with Ric Flair, Mr. Wrestling, Tim Woods, Ricky Steamboat, Wahoo McDaniel,
Wow.
Baron Von Raschke, The Claw, all those guys. It was fun. And but I got really tired of just getting yelled at by people dumber than me, and I mean my bosses.
Mm,
And so I just really chafed at that. And it's a to make a long story short, I got stimulated to consider trying medical school, and I found that I had an aptitude for it, and I had worked on just my ADHD. I guess as I got older, it got a little bit easier to control, and I was able to harness it because one of the things with ADHD is you have hyper focus too. So once I decided that I loved physics, I could, and I just had to convince myself I could hyper focus on it and really do well. So yeah, and here we are. So I ended up having to go back to school to take prerequisites, and then this is boring. So hang on a second.
Can you please stop bullshitting?
Anyway, so anyway, so yeah, I went to medical school, and here we are. So
Well, and back, I'm not saying back then it wasn't. Was it easier, do you think, or harder? Because I know lobotomies were still going on up until the 60s or 70s, right? So,
right. Well, I didn't go to. I'm not that old. I'm old, but I'm not that
okay.
old. I was a kid in the 50s and 60s, but yeah, I went. It was well, in some ways, it was much harder because we didn't have. I mean, I had a computer. I had a Commodore 64. I used it a little bit in my 4th year of medical school to do presentations and stuff like that, do the outlines. I had a word processor out. That's basically the only way I could use a computer at that time. Everything else was was pen and paper. And if you wanted to look up an article, listen to this shit. So you had to go to this thing called Index Medicus. It was this giant book, this big, that had keywords in it. You'd go down, find keywords, and you'd find articles that had the keywords in it that you were looking for. Like you wanted something on digoxin and congestive heart failure. So you'd look up digoxin and congestive heart failure. You'd flip through this giant book, and then you'd find articles. You'd have to write down the citation. Then you'd have to go to the library, find the journal, and that's assuming some asshole didn't take it and misplace it or just steal it. And you had to find the journal and flip through, and then you had to make copies of it. Now you just go on PubMed and do a literature search. When that business first started, you had to go to the librarian, and they were the priests that controlled the mysterious knowledge, and they would do the literature search for you. Now anybody can go to clinicaltrials.gov and do a search on clinical trials. Anybody can go to PubMed and look at all the medical literature that's out there, and have it at your fingertips immediately. So in that way, it was harder. I think there's more knowledge now about some things that makes it a little bit more difficult. But yeah, I mean, it's not easy.
Oh, yeah.
But if you're called to listen, I feel like I was called to do it because so many things just fell into place that helped me along on that road. And I'm not going to say on that journey because I hate that. But on that road, a lot of things just sort of fell into place. But I feel like I was kind of called to do it. And if you're called to do something and you refuse the call, you end up in the belly of a fish. Just ask Jonah, right? If you know your Old Testament story. So anyway, so yeah. And then I ended up doing hospice care down the road because my mom had now I'm being a bummer, but my mom had the worst death to this day that I've ever seen, and I didn't want anybody
Dang.
else's mom to go through what mine did. So I endeavored to learn everything I could about end of life care and try to make that passage a little bit easier. So anyway, yeah.
No, that's amazing. And specifically, what type of doctor are you? Because I know there are many types of doctors, and you know,
Well, right. So you start off being a generalist. For example, if you're going to be a cardiologist, you have to get a degree in, or you have to get, do a residency in internal medicine, general internal medicine, and you have to pass your boards. Then you can go on to specialize. So, I started off as a generalist, and then I specialized in my current specialty. So, yeah.
mm,
And then, and, along the way, I've always liked comedy, and I've always liked, just being around, I was in my degree in radio, television, motion pictures, radio shows and stuff like that. And I used to buy Howard Stern. There was a guy that would tape all the Howard Stern shows and then burn them on DVD without any ads. He would cut the ads out. And I would just sit there and listen to these DVDs because we couldn't get it. And then when SiriusXM came out, they just had Monsters in the Morning. They didn't have Howard Stern, they didn't have anybody. And then there was these people, Opie and Anthony, that I sort of remembered seeing on Bill O'Reilly when they got fired because of Sex for Sam. And I tuned in and I loved it. I was hooked from the first moment. And I back then, Jim Norton and Anthony and a couple of the other people were on this thing called AOL Instant Messenger. And I just ran into Jim Norton one day. And he was like, "Are you really a doctor?" I said, "Yeah, I am." He said, "Well, I have this lump on my scrotum." And so we talked about it. And the only reason I can talk about it now is that the next day went in and told the story. And so the next day he went in and said, "Yeah, I was talking to this doctor from Tennessee about this lump on my scrotum." And Anthony chimed in. He said, "Yeah, because we know all the best doctors are from Tennessee." And I went, "You motherfuckers." So I went and I got my CV. At that point, I'd had about 100 articles in the medical literature. I was editor-in-chief of a medical journal. I was, a professor at a medical school, all this stuff. So I
Wow.
called him up, and I don't know who I got, if it was Danny or E-Rock or whoever answering the phone that day. And I said, "What is your fax number?" Because back then, these radio shows had fax numbers. And I said, "I'm going to fax my resume to you guys," because it pissed me off, right?
Yeah.
And in a funny way. I mean, I just thought it was funny. So I sent them my CV. They thought that was funny that I did that. And then they started calling me about stuff. I was behind the scenes for the longest time before I was ever actually on the show. And they would call me and say, "Hey, is this a cinnamon challenge? Is it safe for E-Rock to do that?" And I would say, "No, don't. Yeah, please don't do that." And then they would do it anyway, of course. And that's a great video. If people watching this have not seen it, just Google E-Rock cinnamon challenge. I think there was, I mean, there might have been a 1% chance that he didn't make it through that. He's young and healthy, but if you watch that, they were a little bit concerned there for a split second. So vindication.
Did you ever imagine like the 2 degrees that you actually had meshing together like that? The
No.
media with the doctor?
I always tried to figure that out. The first thing I did was try to do my computer skills with my media skills and my medical skills to make 3D renderings of organic chemistry molecules. Because they're hard to visualize in your head, but I thought it'd be cool if you could have a thing that you could rotate it around and see right-handed and left-handed molecules and stuff like that. So that was the first attempt, and that really didn't go anywhere. And then when I was in medical school, I did things like our fourth year skit was a 90-minute play that I wrote and directed and produced. And it was a musical, and we had an orchestra and all this stuff. I got to do that kind of stuff, but still, even that wasn't really satisfying. So when Opie said, "Hey, we've got the Saturday Night Virus. If you have an idea for a show, I've got these golden tickets, and if it's a good enough idea, we'll give you one." And I immediately emailed Steve Carlisi, who, rest in peace, Steve. He was the sweetest, nicest guy, and he always emailed me back. If I emailed him, he would 100% of the time email me back. And as the executive producer, I said, "Listen, I got an idea for a show," and I just made up a name on the fly. I said, "Well, we'll call it Weird Medicine, and we'll talk about your audience and their lack of hygiene or lack of healthy habits or whatever, and I'll tell horrible medical stories." And he said, "I like it a lot. Let me take it to him." And a week later, we had the green light, and a month later, we were in the studio doing our first show live. And I was sitting in Anthony's chair with Anthony literally sitting there watching me. Talk about nerve-wracking.
Oh man, no, I
When I
can't
showed up at the
imagine.
studio that night, he's like there, and I'm like, "What are you doing here?" And he said, "No, I'm going to watch you do your show." And I'm like, "Oh, Jesus Christ." And I'm sitting in his chair. And, but after it was over, I bumped my first guest. We had so many phone calls. They said, "Listen, you got to start taking calls." I had all these topics that we were going to do, and they said, "You got to start taking calls. The screening software is overloaded. I mean, every single line was full, and there was a lot of pent up demand." And E-Rock was supposed to be my first guest. I only had 90 minutes, and that we had so many calls, I had to bump E-Rock. So they all thought that was funny. Hey, Dr. Steve came here. The first show, he bumps E-Rock. So we got through that, and Anthony came up to me afterward and said that was the best first show that I've ever seen. And we were on cloud nine. We were like, okay, we got to buy, a condo here in Manhattan and all this stuff. We thought we were going to be getting Howard Stern money. At this point, I would take Sam Roberts money, but that never happened. We did our first year's worth of shows for free, and then down the road they started paying us a little bit. But it's I've been doing this now for 20 years for them, and if you put all the money together that I've made, and I'm not doing it for the money, obviously, but it's just funny. I think I might have made one of Anthony's paychecks at the peak of their career, cumulative. So, and he probably got paid every 2 weeks. So, but anyway, it's like I said, I'm not doing it for the money. I always wanted to do it just to give back. Opie and Anthony and Ron and Fez particularly took me out of a really deep depression, and I felt like I owed them something. So I'm okay doing that for free. And now we've been the longest running show on SiriusXM channel 103 by a mile. And that includes Opie and Anthony and Ron and Fez and Jim and Sam. We've been there. It'll be hard to beat our record at this point. Not that it means anything. I just kept my head down, and I cost them nothing. I produce the show myself. I give it to them. All they have to do is put it on the server. They don't have to spend any time, editing or putting the show together. Some of the other people who would just record their show and then hand them raw audio, and then they'd have to have a producer put it together. They ended up kicking them off the platform when they started to contract financially, when they weren't spending as much money anymore. But for that's the only reason I'm still there, is just because I don't cost them anything.
Well, you could say it was part of the path, I guess. Or
Yeah.
the
Well, and if you have a show on satellite radio, as unregarded as it may be, at one time we were, when the Saturday Night Virus was going on, several of the people from XM estimated we had about 150,000 people listening at any one Saturday night. And now it's maybe a tenth of that, I would guess. I don't know the actual numbers. But when you have that, even if you don't know, even if nobody's listening, but you have a show on satellite radio, it's a little bit different. You're not just some schlub with a podcast like everybody else, so it does help in that regard, just for me to say, well, we have that, we're doing a radio show for SiriusXM and we have a podcast, rather than I just, I have a podcast, I'm trying a Patreon and a Cameo, all that stuff that I do plug. But yeah, it's just, I don't know. I never felt like anybody was actually listening anyway, so I'm always amazed when somebody comes up to me, or if someone recognizes my voice in line in the airport in Hawaii, which happened once, and it always blows my mind. But anyway, there you go.
No, that's amazing. I was gonna ask do you feel ghosts and witchcrafts, or like witchcraft is real, like in the clinical world?
Okay. Well, I've seen things that I can't explain, but the thing about ghosts, this is what you have to posit: some sort of mechanism. There has to be a mechanism. If ghosts are living information, right? They have to be. I mean, there's information there. So if you have information, there has to be energy. Well, where's that energy? Is it in some other dimension? Okay, well then how do we breach those dimensions? We're reasonably smart. How can they do it and we can't? So My wife likes to watch these ghost shows on TV. You've seen them where they put the GoPro on, they turn the lights out, and they scare themselves. And ooh. And I said, "Why are you watching this?" She said, "Well, on the third floor of this hotel, 3 people died, and now it's being visited by poltergeists." And I was like, if that were true, every room in the ICU where the vast majority of deaths occur in the hospital, and 25% of people in this country die in the ICU or immediately after ICU treatment, and it's very traumatic for a lot of people. If that were true, the pictures on the walls in the ICU would be floating off the wall, all every day, and you'd hear "get out" and all. Come on, none of that happens. So that makes me doubt the whole ghosty thing. And just give me a mechanism. Don't just make up stuff. Oh, it's bioenergy or energy field. Okay, well, then we should be able to measure those. And we should have, at this point, after tens of thousands of years of human civilization, we should have incontrovertible evidence that there's persistence of memory, aka information, that goes on after we die. And even the people who have near-death experiences in the operating room, you've heard of these where they say they're floating above the operating thing. They could see people operating on them. They did a clinical trial on this where they took one of those neon, like a neon sign or a rolling sign, with like a marquee, and they put it up in a place where you could only see it if you were floating above yourself. It was pointed up, so if you look down, you could see it if you were looking down from the ceiling. And it had a specific word on it. And 100% of the people who had this experience that they interviewed could not identify that word. They'd say, "Oh yeah, I was looking down and I could see you guys operating on me, and I saw when my heart stopped, I saw all that, and I started to go toward the light, but then I came back." And they'd ask him, "Did you see any words or anything like that? Did you see anything? Can you identify any words for us?" And 100% of them couldn't do it. So it appears to be something internal. I want to believe. I mean, weirdly, I am a believer, but I think that faith has nothing to do with evidence. Faith by definition is something you believe in despite the fact that there's no evidence. So, yeah. So anyway, I'm fascinated by the topic. I was all in on uh, spiritualism and occultism and stuff way, way back in my past, but I became really disillusioned by it. Just getting burned over and over again. Same thing with UFOs, just burned over and over and over again. And as we learn more things, I mean, I saw a video of a UFO that was obviously a ham radio balloon. And but I would only know that because I'm a ham radio operator. If you weren't a ham radio operator, you'd see this thing moving with all these things dangling down below it, and those are just all the different APRS and different antennas and stuff like that. And we see them all the time. Matter of fact, the United States government shot down one of those when they thought it was one of those Chinese. Remember, the Chinese sent the balloon over, and we just let it go, and finally shot it down after it had done everything it wanted to do. Well, then they started shooting down balloons, and one of them was one of these ham radio balloons that got destroyed, and some poor ham, amateur radio operator was lost about $1,000 worth of equipment, and I'm sure is very pissed. But anyway, so
No,
I've just been burned so many times. If you got a UFO, land on the White House or the Kremlin, or land somewhere and come say howdy do, and then I'm all in. I want to believe. I want to. How can there not be aliens out there? And if we are the only intelligent life in the observable universe, that doesn't mean we're the only life in the universe. But if we are the only intelligent life in the observable universe, why are we arguing over whose religious book is more real, or who is more I don't know, or why do we get mad that they gave us mild sauce at Taco Bell instead of the hot sauce? There's much bigger. There's a whole universe out there that may be ours, and we're arguing over this petty bullshit. In my opinion, we should be spending a lot of resources figuring out how we're ultimately going to get off this planet, because the sun we've got about probably less than 1 billion years. It seems like a long time, but it's not. And when it comes down to next step evolution stuff, well, maybe it is. 100 million years should be plenty, but we got to figure out how the hell to get off this planet and get out there and see what's out there. And if the dark forest, do you know about the dark forest hypothesis, why we don't see aliens?
I need a refresher. I've never heard it called that.
The dark forest idea is that if there are malign creatures out there in the forest, you don't want to go announcing your presence, because then they're going to know you're there and they're going to pounce on you like a saber-toothed tiger or something like that.
Mhm.
And so maybe the universe is populated by malign forces, and everybody else but us knows to keep your fucking mouth shut, or they're going to come after you. And here we are going, here we are, everybody. Hey, how are y'all doing? and then they're going to come down on us. Well, you sure have a purty mouth. It's going to be bad. So that the 3-body problem, spoiler, that's what the second book is about. This idea that there are other beings out there, but they're all terrified of each other, wiping each other out, so they just keep quiet. So,
Well, no, that makes sense. I was gonna ask too, like, because I've been lately. I had another like test with my psychologist, and those tests always ask you if you hear voices,
yes,
or if you see ghosts, and I'm just
yeah,
wondering, why, why
okay.
consistently it's always that,
I can tell you why. What they're looking for is psychosis.
Mhm.
So people who have certain circuits in their brain that aren't functioning properly will literally hear voices. I mean, their auditory centers will turn on and they're hearing voices, and the voices can tell them to do stuff. And sometimes the voice won't shut up till you do it. Then it'll shut up for a minute and then it starts back up again. So like Boss Man Jack with that cycle, it just goes on and on and on. And
Mhm.
there have been people who were told to do things that were, very naughty, and they did those things. So it's an important screening tool to look for psychotic behavior. That's what that's about. Auditory hallucinations, and then sometimes visual hallucinations as well.
Yeah, but you couldn't confuse it with like your own inner monologue, like just me talking to myself, telling myself, certain
Right.
things.
Well, with these folks, that inner monologue turns into what they perceive as an external monologue. It's coming from outside themselves. And there are a bunch of switches in the brain. It's the only way I can sort. This is the model that I work with. There's all these switches. There's like a truth switch. And oh, this seems right. This doesn't seem right. And all of our truth switches are a little bit different. That's why we have different opinions about things. But if you are psychotic, that truth switch becomes so misaligned that you start feeling like people are watching you through your TV, and that's true. And you can't shake the idea that people are watching you through your TV, or your bowels are being controlled by mere spacecraft. That
Mm.
is a very specific example. I can't talk any more about it, but it's a very specific example. Um, and those kinds of things happen. That switch gets turned on, or gets misaligned, and they can't fix it. So some of the medications will help calm some of that stuff down. And there are some people that become psychotic that they have one episode and it goes away and it never happens again. Other people become chronically that way, and then those are the ones that really need intensive help. But that's why they're asking you that.
Okay. No, yeah, it's because I have real terrible anxiety. I know I have like I've diagnosed myself as agoraphobic because I haven't been
Okay.
able to really leave the house or
Okay.
a safe area. I could go
Sure.
down the street to the store,
Yeah.
but that's about it. Um,
Well,
Yeah, what would you say there was a way to calm my fears naturally, or
I had
use
the
like
same thing. So here, this whole time I've been talking about myself. We should have been talking about you, and I apologize.
No,
No, for real. This I know something about. And just to let you know that I know what you're going through. I caught somebody trying to break into my house, and I had this sort of fantasy of this sort of safety bubble. And when I caught the guy, I was like, "What the fuck?" And he just the cold, dead, eyes just looked at me and went, "Yeah, man," and just sort of walked out. And he could have killed me, he could have done anything. And it was all the what if, what if, what if. But the fact that I didn't scare him at all, he just left because he chose to, freaked me the F out. And so I had started having horrific anxiety, crushing anxiety that made me sometimes just curl in a ball and want to check myself into an insane asylum.
Mm-hmm.
And I know we're not supposed to call it that anymore, but you know what I mean.
Yeah.
Into a psychiatric ward. And it continued, it persisted. And later on, I'm going to tell you how I cured myself of that. But what I learned later on is that this is how people become agoraphobic, because for me, I would go out, and if I got into a crowd, I would get uncomfortable. I'd say, "There's murderers here. There's you people walking around having fun. You don't realize there's criminals and murderers walking on these sidewalks right now, and you don't even pay attention to it." I was the only one that was hyper vigilant that understood this. And I realized through research later that what happens is people have that experience, say, at the movie theater, so they don't go to the movies anymore. And then they have that experience at the grocery store, so they don't go to the grocery store anymore. And then they have it when they're driving on the interstate, so they don't go to the interstate anymore. And then they have it when they're driving in general, so they don't drive. Then they have it when they're going out to get the mail, so they don't do that anymore. And then the next thing you know, they're stuck in their house, and that is agoraphobia. Now, for me, I don't know what it was, but I'm going to give you what I think is a pathway out of this. I could have easily become agoraphobic, but there was something. I was just getting ready to go to medical school. I was doing research in a lab that was very important to me, and somehow that was more important to me than my discomfort going out. And I had my moments, right, where I was just, in the house doing this. But I forced myself to go every single day to work. I didn't miss a day of work. I forced myself to do things that made me uncomfortable, like going to concerts or going to the movies or going out to dinner in a crowded restaurant. And what happened to me, how the day the tide turned, I went to the North Carolina State Fair, and they had 5 days worth of fireworks that they had not shot off because of rain. And so this was the last day, and they were going to shoot them all off. And my love of fireworks defeated my fear of being in a crowd. It was a huge crowd, and at the end of this thing, they shot off all these fireworks. It was the greatest finale I've ever seen to this day. I mean, they just shot off 5 days worth of fireworks in a space of 10 minutes maybe. Now, when it was over, all of us had to go through a chain link fence with a door in it that was about this big, and there's 10,000 people all trying to get out. And so I'm like this, just wall to wall people, my biggest just discomforting stimulus. And my wife at the time, just who knew I had this problem, looked at me and she's like, "Are you okay?" And I'm like, "I guess I'm either going to have to die right now or I'm going to have to get better." And something inside my brain switched and it said, "I'm just going to get better." And then it started decreasing. It didn't go away immediately. I still didn't like walking in front of a window if I couldn't see outside. Like, it was dark, it was light inside and dark outside. I didn't like that. I still had moments of anxiety, but over the next, say, 6 months, it declined to the point where, I still have my anxieties, but they're completely, manageable. And, I think they're more like quote unquote normal anxieties, things that people get anxious about. So I only tell you this, and I know I've been monologuing, I apologize, but to let you know that I feel your pain. I've been there. And if I can defeat this, you can defeat it too, but it requires challenge. You have to continually challenge it. Yes, you go out, you have anxiety. What does that do to you? You feel uncomfortable. Your body's telling you, if you go outside, I'm worried you're going to die, right? And it's like,
Mhm.
who's telling me this? It's, I know that's not true. Who's in there telling me this, right? So you have to convince that part of your brain that it's not going to kill you. So to do that, you have to challenge it. People who have fear of flying, they do challenge therapy. They put the virtual reality glasses on and they put them in a plane, and they do as much as they can every day. They do a little bit more, and doing a little bit more every day. I'm not saying go and go to drive to DabbleCon and have a big weekend, although I would love to see you do that.
Oh yeah.
But do something that makes you feel uncomfortable, and then don't stop. Once you've done that, you can't go backwards. It's like quitting smoking. If you're going to quit by time, you don't smoke until 9 in the morning, and then you can smoke as much as you want. And then the next day you go to 10 in the morning, you can smoke as much as 11, 12. But once you get to, say, noon, you can never go backwards. You have to always keep pushing forward. And talk to your shrink. It sounds like you have a shrink. Talk to them about doing some challenge therapy and let them come up with a program for you. I've had other patients that I've walked through this, and once they understand that I know exactly what they're talking about because I've been there, because otherwise you got some doctor going, well, you just, you got to get out there and do stuff. And it's like, well, okay, asshole, you don't know what it feels like. Well, I do know what it feels like. I mean, it could have destroyed my life for real. And, but just, I don't know if it was, I don't know why I had that I don't feel like I'm a really strong person, but there was something inside me that said, I'm not going to give into this. And that was successful. I don't have panic attacks anymore. I don't have chronic anxiety anymore. I don't take any medication for that. And you can do that too. Now, are you on medicine now?
Yes.
What are you on,
A,
if you don't
a,
mind?
a lot, like
Okay.
buspirone, clonazepam, clonidine.
Okay.
What else? I'll say the sky's the limit. I know there's a few.
Seroquel or olanzapine or any of those?
Quetiapine,
That's Seroquel, yeah.
propranolol.
Okay, that keeps your heart from beating too fast, yeah.
Yeah, and yeah,
So
that
does it work for you? I mean, you able to get out of the house with all that
just
cocktail of medication?
at least just down the street. Not really. Barely even able to. I can function at home, but once the sun goes down, I don't know if it's
Yeah, no,
because
dusk was hard for me.
yeah, I don't know if it's the darkness or just because I'm tired,
Yeah,
that causes the fear to
yeah.
start getting more and more inside of me.
Yeah, well, we have this diurnal rhythm, that goes by the light and dark, and dusk was always rough for me. Once it became dark, I was okay as long as, again, I wasn't in front of a window that someone could see in, I couldn't see out. But,
Mhm,
you see, the thing is, the concern I have is you're on 5, pretty strong medications.
mhm,
One of them is quite habit forming, and yet you still can't do what you wanna do, you know?
mhm.
And that's a concern. So you have virtual reality?
No.
Okay.
No, I don't.
Listen, I'm not your doctor. I don't wanna prescribe anything. Talk to them. A virtual reality helmet might be a way that you could do some challenge therapy within your own home. You could go to Giza and look at the pyramids and stuff. And if it freaks you out, you just take it off. But next time you do it for a couple of minutes, and then you try to extend it and do more and more. Talk to them about that. It might be a worthy investment. And I'm doing actually a clinical trial on virtual reality in the chemotherapy suite right now
Mm,
for chemotherapy-induced anxiety. Situational anxiety. So that'll be interesting. But there's some real therapeutic benefit to some of that. And there's an app called Trip, TRIPP, that teaches breathing and in a virtual environment that it has clinically proven to decrease anxiety. And that might be something that you could try. Again, talk to your provider. But I, what the attack you can do is, listen, hey doc, I'm on 5 medications. I can still just barely go down to the street. Could we, maybe attack this from a different angle? And just see what they say, because I would love to see you get out. I want to see you get out. You need to come to these events. People would go crazy if Lorenzo Areola came to DabbleCon, or Hackamania. That's Las Vegas closer to you, right?
Yeah,
Okay.
definitely. I'm in Texas.
Let's work on next year. You're coming to Hackamania, and it's going to make you anxious just even thinking about it. But let's see if we can't you and I'll work together a little bit. I'm not your doctor, but I'm your friend who had a similar problem. And so, like, your sober coach, I can work with you on this. But we need buy-in from your medical provider that's doing this. So talk to them. If you're cool on that, we could have that as a goal, that you're going to come to Hackamania. And if you get anxious, you just, you could go to the green room, you could go back to your hotel. That's a home base for you, that kind of stuff. But I think a year, you could probably pull this off, and you could have agency to do what you want to do. You're young. You should be able to do whatever you want to do.
No, I appreciate that. Yeah, no, yeah, and of course, I do have motivations, like my niece and stuff like that, to get
Yeah.
out more.
Yeah.
And yeah, I do want to. It's just it's just sometimes it overwhelms
Yes.
your own mind,
But knowing that it can be defeated is the first step to saying, oh, well, all right, then I can defeat that. I don't have to live with this. My brother is a physician, and I had a really bad anxiety thing going on. And it was so bad, I would get nauseated. I wouldn't eat. I was losing weight and stuff like that. And I told him that my primary symptom at that point, not besides the anxiety, was just nausea. He gave me a medication called Combid, which was Compazine, which is an anti-nausea medication. It's related to the Seroquel. But when I took that, my anxiety completely went away. I mean, I was normal. I was normal again. Now, I didn't want to take medicine chronically to make myself feel normal again, but what it did was it told me I could be normal again. And that really helped me to see the light at the end of the tunnel, that this could be defeated. And that also was a big step. Those two events really helped to put me in a place where I could defeat my anxiety. Maybe I should write a book about it, because I know so many people deal with this. And one of the things that will be difficult for you to get off the clonazepam. That should be the last thing that you get off of. Some people might argue that should be the first thing, but that drug now, when it wears off, causes you to have anxiety, because your body wants it again. It wants that stimulus again. And that's my problem with that class of drugs for anxiety, is that after you've taken it long enough, when it wears off, the anxiety comes back because the drug isn't in your system anymore. And I think that's a problem. Then it becomes a thing where you just have to have it. And you'll want to get off of that at some point if you can. And if you could do it without pharmacology at all, it'd be the way to go. You
No,
smoke pot?
yeah.
You smoke pot?
I've tried it,
Okay.
just
I'm
because
not
for that.
advocating it. I was going to
Yeah,
say, if
yeah,
you do smoke pot, I wouldn't. It can,
yeah.
particularly the sativa strains, can make anxiety worse.
Ooh, no, I've tried it. Just I got to a point where it's like I'm gonna try anything, throw
Yeah.
everything at the wall and see what sticks. And
Yeah.
yeah, it didn't make anything better, not at all. No.
Okay. Yeah. Right. There may be some role for it in low doses for particularly the CBD um, part of the extract may be helpful, and using just pure THC or indica rather than sativa, but I'm not pushing that. There is some role too for ketamine in chronic anxiety, and that's sort of really sort of out of left field, but for people who have tried everything else, there is very low dose ketamine treatment that is very affordable, and can be gotten from compounding pharmacies. There's a company called Joyous that does it. Now, Mindbloom does the higher dose, but the very low dose ketamine from Joyous is like $128 a month. Now, again, I wouldn't do that. I wouldn't recommend that to you or anybody else without talking to your provider first. Don't do it because I said. I'm just letting you know there are other things out there. Psychedelic therapy may be something in the future for post-traumatic stress disorder, anxiety, and depression. It's coming. Psilocybin was being highly, vigorously researched in the 60s until Timothy Leary decided that he was going to popularize it, and all of the funding dried up. So although I appreciate Dr. Leary, bringing the idea of psychedelics to the masses, the way that it was done, stifled research for 40 years. We're only just now starting to do research on psychedelics again for PTSD and depression and stuff. So we'll see. Hopefully, it'd be nice to have something other than just let's dump more serotonin into people's brains, or let's dump more dopamine, or these kinds of things where they're just sort of we're dumping buckets of neurotransmitters into people's brains with these drugs. And the psilocybin does some of that as well, but it attacks certain receptors. Same thing with the ketamine. It increases what's called neuroplasticity, so that you can change those behaviors inside your head. The behavior, if you're depressed, that says you suck, you suck, you suck, you suck, you can turn that circuit off through the use of neuroplasticity enhancers like ketamine, things like that, done properly, not just done on the street. That always breaks my heart when people have to resort to going to the street to self-medicate when the medical profession should be providing those things for people in a safe environment and doing it properly. But anyway, so there's hope out there. Yeah, for real.
And do you would you recommend like a religion, like is that always a good thing, or is it just
Depends.
a hit or miss?
Spirituality is one of those things that doesn't have to be religious. Spirituality can be a fountain of strength for a lot of people. Organized religion can cause anxiety, particularly if you're considered, not following the rules or whatever. I'm not crapping out. There are a lot of people that are very religious out there, and I have mad respect for them. But I wouldn't go to that just to treat my anxiety. I would go to that because I'm called to it, because I have a need for spiritual fulfillment. And there's all kinds of stuff out there. It doesn't have to be just religious,
I'm about to say like the dabblers. Is there is that a good organization to be a part of, the dabblers?
For anxiety? No. But it can be fun. Like everything else, there's a level of toxicity, and then there's a level of fun where people are just having fun. And then there's the other people who get angry about things or yell at each other, and for that they're increasing their anxiety level. So you have to decide. Listen, I love the dabblers. They came to my defense when I was being attacked, and when I couldn't really defend myself because of my job and things like that. And that really showed me that there's a lot of heart there, and I really appreciate that. I'd never take that for granted, and it was a very humbling experience. So it's people, it's a bunch of people. It's not a monolithic thing, and my impression of people is they tend to be good. And there are a few stunks out there, but for the most part, people are good. And it's a fun group to be a part of. If you go to one of those events, like when you come to Hackamania next year, even though a lot of it is roast type stuff, crapping on people or making fun of people or getting into radio wars or whatever, the people that are there, it's like a love fest. Everybody just is so happy to see each other. They've been talking to each other on the chat rooms and in the live chat, or maybe they've seen somebody on a show or whatever, and it's just so much fun. And you would be a huge, I mean, people would come up to you, want your autograph and stuff like that, for real. So it would be loads of fun. It for that reason, I would say yes, that it would be a good thing for you. Just to experience that sort of group love kind of thing. I know it sounds overly dramatic, but it really is kind of like that.
No, yeah, you're absolutely right. There's a therapeutic
And yes.
to it, you know.
Yeah, just knowing that there are other people, like-minded people out there, even if they're like-minded in just crapping on one person. I get that. But anyway.
And I was gonna ask a couple questions real quick. If
Yeah.
if I fart while I'm running, would it make me go faster?
Sure. Yeah, it's probably, if you had a sensitive enough instrument, you could measure that. The way that you would know is to put yourself in a inertia-less environment, like microgravity, and every action has an opposite and equal reaction. So the energy that you shot out of your ass would cause you to propel forward if you were in space, for example. So if that's true in space, it would be true on Earth as well. It's just hard to measure it because you're moving so fast, and the amount of energy that's being released with passing gas is minimal. So even after a colonoscopy, it's still minimal. It's never enough to like lift you off the seat. So yeah, there would be, with a sensitive enough instrument, you could measure an increase in velocity during the time when you're passing gas. Sure.
Okay, no, it makes sense. And
Yeah.
what in this monkeypox thing, is this a real thing? Is this something to be real
It's a real
afraid
thing, but I wouldn't worry
afraid
about
about?
it.
Okay.
Wouldn't worry about it right now. This mpox, there's these different clades of mpox. They don't call it monkeypox anymore. It's now called mpox. And
Mm.
these different clades are like the equivalent of strains. And so clade 2 was the one that was very, it happened, and then we didn't hear about it again. This one is clade 1b, and it's more contagious and it's more fatal. But they've had cases in, I think, Scandinavia, and although 4 in 100 in the originating country were dying of it, I don't think anybody died in these Scandinavian countries where it was. There are vaccines for this that are not mRNA vaccines. They're normal old school vaccines for the people that are worried about mRNA vaccines. And so we defeated smallpox by going to cases where a smallpox um, um, outbreak happened, and then vaccinating everybody around it. And you created a firewall beyond which the virus couldn't go.
Mhm.
And it was very successful, to the point where there hasn't been a smallpox case on planet Earth since the last one, whenever that was, 15, 20 years ago or more. I'm not an expert on the exact timing of that, but there's no more smallpox. It exists in the laboratory, so somebody could bring it back out again someday. But right now, no cases. So we can defeat this thing too. It'll be the same sort of strategy. You want to vaccinate as many people as you can with the doses that you have to decrease the vulnerability in the population. And then when you just have sporadic cases, you go to those places and you make sure everyone around that person is vaccinated. You keep them in isolation. Anybody came in contact with them, you vaccinate those people, and then the virus doesn't spread and eventually goes away. So it's a thing. The reason they declared it an emergency was so that resources would be put toward getting those vaccines into the hands of people that needed it. But I wouldn't, right now, I'm not concerned about it. I may eat my words on that. But right now, I'm not concerned about it affecting us. And the places where it is affecting right now, I think there will be resources for them to defeat it as well. So,
Well, that's good to hear. No,
yeah.
I guess it's just a hot topic with all the,
Well, the media is always looking, and I hate to sound like that, but it's true.
It's
They're
true.
always looking for the next thing. And one of my things on my Twitter that I was doing for a while was taking clickbait bullshit medical and science titles. There's always one in my Google news search that says this asteroid is hurtling toward Earth, NASA warns. And the NASA keeps tabs on all these things. The closest this thing is going to come is 4 million miles from Earth, which is the moon is 250,000 miles. So just you do the math, it's 8 times farther than the moon. Not coming anywhere close to us, not ever going to hit us. There's no orbital mechanics that say it's ever going to hit the Earth. But NASA tracks these things. And then some journalist or their editor puts out a headline, hurtling toward the Earth, uncomfortably close or whatever. So, fuck off with that stuff. Things are bad enough without journalists trying to make it worse by, having these. But everybody wants you to click on their articles so that they can sell their ads. And that's really where that's coming from. It's a bunch of bullshit.
No, I completely agree. And
so monkeypox is a thing. It is. it has been declared a global emergency, but that's to mobilize research sources. And I don't think, looking at the data right now, that it's going to be a huge problem throughout the world. They just want to make sure that they're putting the money toward taking care of it right now.
No, that makes sense. And especially like you said with the headlines and all that.
Yeah. Global emergency is different than a pandemic. When they declare something a pandemic, that means it's spread to a certain number of countries. And they even hesitated to call COVID a pandemic at the time. I remember when it happened, it's like, why haven't they declared this a pandemic yet? It hit 25 countries and they still hadn't. They dragged their feet on that. There was a lot of silly things that went on during that thing that I hope we've learned from.
I hope we're not Boss Man Jack with that. And we
right. Here we go again.
Yeah, I hope we learned from that.
Yeah.
No, and I'm gonna ask you one last question again. Thank you for your time today.
Yeah, man. Yeah, thank you. No, I enjoyed it.
No, what's the secret to a long life? Is it happy wife? Is it Mediterranean diet? What's Dr. Pepper? You know what they say? What's the secret to a long life?
I don't know, dude. Not smoking. Not smoking is a good one. And controlling your stress, coping with stress, finding good stress coping mechanisms, and having good genetics. The people that live to be 120, you know why they live to be 120? They don't ever get sick. So if you want to live a long time, don't get sick. Easier said than done for a lot of people. But there is data out there that we are what we eat. So, and my philosophy has always been everything in moderation, including everything in moderation. In other words, every once in a while, you got to blow it out your ass. I really think, just clean out the pipes. And if you are constantly clamping down on yourself and feeling like you're depriving yourself of things, that is a form of stress that can come to bite you in the ass down the road. So you need to give yourself a break every once in a while and let yourself have that extra piece of cake or pie or whatever. I always used to say, two small pieces of cake is like one big piece, right? It's the same. So but that's how I would justify going and getting a second piece, when I was eating things like that. But anyway, yeah, stress is the mind killer. That's the thing that'll really get you. So
no, yeah,
I don't know. I don't have the answer. Have good genetics.
Well, no, thank you so much for your time, man. I appreciate it.
Man.
And your
we'll stay in touch. We're going to get you to Hackamania. It's not too far from you. It was so much fun last year. I had the best time. The people are great. Patrick Melton looks and sounds scary, but in person, he's a sweetheart. People will shit on me for saying that. I'm telling you, he's just such a nice guy in real life. And I have evidence of that.
That's kind of disappointing to me because I thought he was a jerk from the internet. That's kind of disappointing.
Well, a lot of these guys are. Kevin Brennan is one of the nice people that I've interacted with outside of this. He's just a nice guy. He's just a person. Yeah. And that's what Melton said. I told him, I said, I was a little scared to meet you and, work with you. And he said, yeah, I'm just a person. And that's what it is. If we would just see each other as people, maybe we could get along. Everybody gave hell to Rodney King during the riots when he got up and said, "Can't we all just get along?" And people made fun of him. But it's one of the most profound things I think has ever been said in public since I've been alive. Can't we all just get along? And the answer is, it's so simple. But the answer is, yes, we can, but we choose not to. That's it. That's the answer to that. He was 100% correct to say that. Can't we all just get along? Why can't we? We just choose not to. I would like to see people start to choose to get along. That would be incredible. But I don't see it happening.
We'll see. Hopefully within our times, right?
I hope so. Well, you and I get along. That's all I care about.
No, yeah. No, and I appreciate you're great, and I appreciate your time today and your advice. It really does help.
Yeah.
And anyone can find you at Weird Medicine, patreon.com.
Yeah. Just anywhere podcasts are found, you can find Weird Medicine. I'm also on a show called Normal World with Dave Landau, and it's on YouTube. It's also on Blaze TV, and I'm on there periodically as a correspondent. So that's fun. Yeah, check that out too.
Well, thank you so much for your time today.
All right, man. Let's stay in touch. Let's talk to each other once a week.
Yeah, no, thanks, man.
All right.
And we'll definitely will. And thanks everyone for listening. We'll see y'all later. Take care.
Take care.